Spain is reporting a case of a swine influenza case. And if you've listened to my videos, you understand that this is an important animal when it comes to influenza transmission. It can be infected with both bird viruses and human viruses, and we think of them as mixing vessels. But in this case, it looks like a fully swine virus infected someone in Spain. And what's interesting is when we get these cases, it's often somebody who's been to a petting zoo, has been to a farm market, has been interacting with swine. This one doesn't seem to be. So did this individual get it from somebody else? Is this something that has some low-level spread in humans? Those are important questions to figure out. This guy wasn't really sick with influenza, so that's another kind of wrinkle in it. But it just shows you that influenza viruses are continuing to try and make forays into humans. Another interesting thing that I want to mention today has to do with vaccines and the value of vaccines. And if anybody who has followed vaccines over the last 70 years, there's a name, Stanley Plotkin, who wrote literally the textbook on vaccines. And there was a really good story about him today in Stat, which is a news website that I follow, which talks about the fact that he's living at a time, he's in his 90s now, where he's seeing his life's work be attacked for reasons that have no basis in science. And I think that must be very difficult for this humongous genius level benefactor of humans to see his life's work, his pioneering work, basically attacked, not because it failed in some way, but because of its actual value, because there's such animosity towards using the tools of science and medicine, some of the tools that Dr. Plotkin himself developed to improve human lives. So that must be very, very difficult, and I think it's really a sign of the time. Another thing is in the anti-vaccine movement is the fact that RFK Jr. continues to remake the public health bodies in the United States government in his image, which is the image of an anti-vaccine advocate. And there are more people that he is appointing now to the Advisory Council on Immunization Practices at CDC, which all have to be vetted by him. So with very few exceptions, maybe one or two exceptions, the ACIP is completely constituted by people who are loyal not to science, not to medicine, not to the human species, but to RFK Jr.'s pet theories. And some more people got added to that. So it really cements the fact that this is getting to be a committee that is completely irrelevant and really should be ignored. It's basically an anti-vaccine propaganda piece. And when it comes to infectious disease doctors, we're kind of the vanguard against this. But when you look at trends, less and less people want to go into infectious disease. Obviously, it's not one of the most lucrative in terms of payment because it's a cognitive specialty, and cognitive specialties, for many different reasons, are not paid the way a procedure-based specialty is. So anybody that uses their brain without actually doing a procedure on somebody gets paid less than somebody who does a procedure on someone. That's one thing. But number two is we get attacked, we get ridiculed. It happens to me every day on social media. And not surprisingly, that's translating into less people interested in infectious disease. And that's another problem that we face. Because if you don't have a robust workforce, if the best minds aren't going into infectious disease, then you're not going to have solutions. And this is sort of part of the ecosystem now with the anti-vaccine movement, the anti-germ theory people having a major influence now in the federal government. And more people are leaving the CDC. So right now, the CDC does not have a full-time head. We think that there are political appointees that are doing the day-to-day decision-making there. And more of the talent pool at the CDC are leaving because who would want to work there in an environment that's controlled by RFK Jr. and his anti-vaccine goons that are controlling all of the output of the CDC and basically compromising its ability, having it fall from a premier institution of scientific knowledge to one where it's just like the ACIP, just mouthing anti-vaccine propaganda, where everything has to go through the secretary's office and not actually go through the normal channels where they look for scientific integrity, not ideological alignment. And in the face of that, we've had multiple measles outbreaks continuing to surge. Right now, we have a major outbreak in South Carolina, but also outbreaks in Florida centered around a religious school where there are more and more cases occurring at that school. And that's not surprising to me because Florida is an area where there is a lot of anti-vaccine sentiment that's government based. The Florida Surgeon General, the Florida Director of Health, a man named Joseph Ladapo, has been very anti-vaccine, and it's not surprising that's trickling into the outbreaks that are occurring at college campuses. Some interesting new things that I wanted to mention. We've talked about the fact that mosquito-borne illnesses are a major scourge and that there are innovative approaches like genetically modified mosquitoes. There is another innovative approach which involves infecting mosquitoes that transmit dengue, Zika, infecting them with a certain bacteria that makes them basically unable to flourish, unable to increase their population numbers, and therefore not able to bite as many humans. And that's infection with a bacteria called Wolbachia. So this is different than genetically modifying the mosquito. This is infecting them with the bacteria, and we're getting more and more data that these types of approaches work, including the fact that in areas where you deploy Wolbachia, you see population levels go down of the mosquito that you're targeting. So that's an innovative way that is kind of an important development to emphasize that it's not all bleak, that we do have some innovation occurring, especially with vector-borne diseases. Another interesting development has to do with sleeping sickness, which isn't really of interest to many people in the United States, but it is an important global health problem. We don't have very good drugs for them, and oftentimes the drugs involve you having to do lumbar punctures to decide whether a person has, what type of sleeping sickness they have. And sleeping sickness is a protozoal disease that is transmitted by the bite of a certain fly in parts of Africa. And now there has been a new drug developed called acozoborol, which is able to work on all types of sleeping sickness, so you don't have to do a lumbar puncture or a spinal tap to decide which drug to give people. So that's a major advance over what we've seen in the past. There's also been major advances that in HIV. There was a big conference that just went on called CROI, and we're finding out more and more that you can simplify regimens, that even from one pill once a day that contains 3 drugs, maybe you can do 1 pill once a day that has 2 drugs in it. And that makes it easier in terms of side effects to manage. And I think we're getting to a point where it's so elegant the way that we can treat HIV, even in spite of the fact that it's still a major public health concern, it's still a major infectious disease, but the treatment options we have are manifold and only increasing. There's a drug that we can use for treatment, but also for prevention called lenacapavir, which is probably one of the greatest breakthroughs in HIV. This is a drug that you can give by injection every 6 months, and it basically makes a person unable to be infected with HIV. It's not a vaccine, it's a drug, but it's as close to a vaccine type of protection that we've seen. And they are starting to roll these out in different parts of the world, including places like Kenya, where certain individuals can get it without out-of-pocket costs. So this is a way that we may see an end to the HIV epidemic if this can be scaled. Other STIs, there's some interesting stuff going on. We're doing things called doxypep, which is doxycycline post-exposure prophylaxis. So taking an antibiotic after a sexual encounter may decrease your chances of getting certain infections like chlamydia, like syphilis. And we're finding that there's uneven uptake. So in the United States, in the South, it's less likely to be prescribed to people, but in the North, in the Northeast particularly, more likely. So this is something that hasn't quite trickled out to all corners of the United States, but doxypep or doxycycline post-exposure prophylaxis is something to think about in high-risk patients, and something for people to ask their providers if they are a candidate. And there's also new antiviral drugs being developed against herpes simplex virus. So with herpes, we really have had no innovation, no new drugs for herpes cases in probably two or three decades. But there is a drug called pratelivir, which may be the next generation antiviral for herpes. And it may be more efficacious, it may be better, but the fact is we're starting to see some work with herpes, which is a very common problem, which doesn't have the best solution for it. Moving now to Mpox. So Mpox is a zoonotic infection, an infection that comes from animals that was responsible for a major outbreak in 2022 and continues to spread in populations, particularly in high-risk sexual networks of men who have sex with men. And we've got a vaccine that was developed for use against smallpox, a related virus, and that has been instrumental in controlling severe disease. But what we're finding is, yes, it protects against severe disease, but maybe after a couple of years, that immunity wanes and the risk for severe disease goes up. So there may be some populations that we would need to use booster doses of Mpox vaccines. This is still something that's being debated. There's not enough information yet to make this an official recommendation, but I think there's more and more evidence suggesting that at least in some populations, the immunity from the vaccine does wane and people do become susceptible and could have severe disease as well. There's been some interesting stuff that I read recently about vaccines and animal vaccines. And the anti-vaccine movement hasn't stopped with just being against human vaccines. They've also kind of extended their animosity towards animal vaccines. And we've seen animal vaccine rates drop. And I've done videos on rabies cases that were occurring in kittens. But it's really important to remember that we're vaccinating animals for their benefit, so that they're protected from those infections and so that we're protected. So animal vaccines are important for manifold reasons, for human health and for animal health. And there are organizations like the Humane Society, for example, where you can get these vaccines pretty easily. You don't have to have a veterinary appointment. Some humane societies have these types of drives. And rabies is the one that's really important because remember, rabies is endemic in our bat species and raccoon species, skunk species in the United States. So that's kind of the roundup of the things that I was noticing today. I don't know if people find this interesting or not, but it's something that I can do with the help of AI, helping me to organize some of the posts into a flow. So let me know if you like this.